Welcome to SRBC 2022. It is a conference of reproductive biology and comparative endocrinology organized by CCMB in collaboration with University of Hyderabad. I am Devanshi Gupta from CDFT Hyderabad. We will be talking to Dr. Narayan Reddy today. He practices sexual medicine in Dega Institute, Chennai. He is one of the first medical professionals to establish sexual problems in South India in the year 1982, and he overcome many obstacles to establish the specialty of sexual medicine. His campaign to establish sexual medicine as a specialty went from a taboo specialty to a more sought after one. So with this, we would like to know more about what are the overcomes he came across and why is it important, and most importantly we would like to focus more on sex education and why is it important for younger generation today. So welcome to Dr. Narayan Reddy in this conference. So would you like to tell us about what is sex education?
In simple term, sex education is nothing but a life skills education. Okay. Just like we tell children how to brush their teeth, how to wash their hands before, and how to study, etc. Sex is a very important aspect or function of human life. So by educating our children about all dimensions of sexuality, not just only on the physicality, but on the relationship aspect, on the emotional aspect, you are making a child, a youngster, a completely mature person to lead a harmonious life in society.
Yeah, this is really good actually, because we always consider, in our society we always consider that sex education as a taboo. Parents are hesitant to talk about it to children. Teachers are also hesitant because we really don't know what terms to use and how to really establish that rapport between a child of a considerable age with an adult. So who do you think should be imparting sex education to adolescents and to adults?
I will first answer your last bit first and then explain.
Yeah, sure.
The best person to teach a child sex education are the parents.
Okay.
Because they are available for the child most of the time. Next comes the teachers. Because the children spend more time in the school apart from home. So these are two important people who are qualified or qualified to do that. Unfortunately, what happened? These parents and teachers, they themselves were ridden with the taboos, their inhibitions, and they are not knowledgeable enough. Yeah. It's like one blind man leading the other blind man. So, in my opinion, if you have to start giving sex education, I would say start with the parents and teachers and then only come to the children. Because without equipping these people, there is no point in directly going to the children. Now, why did it become a taboo? Simple reason, in ancient India, it was never a taboo.
Okay.
It was considered a part and parcel of our day-to-day life.
Okay.
So our ancestors never had any inhibition. That is why in all our literature, in the temple sculptures, etc., you find there is no inhibition. Whereas when the advent of the East India Company and Victorian prudery, we made sex as separate from our day-to-day life. The moment you separate it from day-to-day life, then it becomes enigmatic and problematic. Either you put it in a pedestal saying that it is very sacred, which is not true, or you think it is very bad, which is a negative connotation. So thanks to the British rule in India, what people who are Western educated, they brought in the taboo into society.
Okay.
Now this taboo is slowly going away, thanks to media in my opinion, because media has got a wide range of reach. When I say today media, it is no more the print media, it is electronic and social media also. In fact, social media is very powerful today. And these people help a lot to dispel the myths about sexuality and create more comfort as far as discussing sexuality is concerned. But please, for heaven's sake, train the parents, train the teachers, make them knowledgeable in the subject, make them comfort the knowledge they possess. Without comfort, they can't be good teachers.
Absolutely, absolutely. This actually is a very important thing, that more than the children and the adolescents, it's the parents and the adults around them who should be responsible and considerable enough to control the behaviors of their children and to impart good education to them. But going about sex education, we always think that when we impart sex education, it will corroborate to the better behavior of them. Is it always true that how is sex education can help us understand our emotions?
When we use the word sex education, it has got a pejorative meaning. I would rather recommend, if at all you want to use the word, sexual health education.
Okay.
The moment you add the word health, it gets a positive direction.
Okay.
Now, today when you turn any newspaper today, there are incidences of rape, incidents of dowry deaths, etc. Why? Simple reason. Boys are not taught to accept their sisters, their mothers and other women in society as equal partners.
Absolutely.
So when we give education, not only about the anatomy and physiology, it should be about gender parity, a respect for the other human being, irrespective of the gender, irrespective of gender identity, which includes homosexuals and transsexuals, etc., etc., etc. Actually, homosexual come under gender orientation or sexual orientation. But anyway, we should learn to respect people from different divergent orientation and identity and consider them to be our equal partners. The moment we think that we are superior and they are inferior, they are sinners, they got something wrong, then we start looking down upon themselves and we discriminate against themselves, which in turn creates a problem. See, let us take for example rape. Now, the boys, male children should be taught by the mother that he is not entitled just because he is a male. His sisters are as equally important and competent as he is. Unfortunately, today what is happening? The boy must have just passed or even failed. Parents want to pay him a lot of donation to put him in engineering college. The girl would have come class first. They will not pay money for her to do the professional course. Why? The parents themselves think the girl child is a burden. That's the problem. Today they don't realize it is not just the boys who will take care of the parents in future. Even the girls, women will take care. In fact, they are more attached to parents than the boys. The reason is very simple. The behavioral and developmental brain aspects of the girl children are more towards bonding, and they are usually stimulated by cognitive stimuli, not just sexually, even otherwise, thought process, feelings, etc. But the boys are more amenable to visual stimuli. They go by what is colorful, what is physically attractive. Emotional bonding is not much in them. So the girls will tend to take care of the parent much more than the boys. I am not making a generalization, there are always exceptions. Now, when the mothers themselves indirectly tell their sons that your sister is not your equal, how is he going to treat his wife, future wife, with equal respect? How is he going to respect the other woman in the society as equal partners. For them, the woman becomes a sexual object, not a human being with a emotion, mind, all that thing. So when he doesn't consider her as a human being, he thinks her as only a sexual object. Cannot accept a no from a girl. So he tends to use violence, tries to get his entitlement and resort to all those things. That is why the first important thing, sex education, apart from the basic physiology anatomy, is talking about genders, gender parity, giving equal respect to the other genders, other people with other orientations and other gender identities. That is very, very important.
That is very nice. It's a very important point that you have highlighted, that if all of this starts at home, if we do not discriminate between the sons and the daughters and the way we are bringing it up, a lot of social evils can be eliminated.
Rightly or wrongly, the human race is at the moment patriarchal. Man is supposed to be superior. Unfortunately, our mothers and grandmothers have accepted it. They internalize it. So, when they bring up the sons and daughters, they bring in this patriarchal mindset into their boys and the girls. So, in my opinion, the mother should change first, more than the father. If the mother changes and starts treating both the children of both genders as equals, society will change and the betterment of the future generation.
Yes, absolutely. We all are deeply affected by patriarchy in our homes, and I'm sure we all can understand and learn from it. You mentioned social media as one of the tools for both good and the bad sides of sex education. So do you have a message out for our audience or for our youth who can help, who all obviously are good users of social media, so how they can make it better for educating themselves and to educating their peers in terms of sex education?
People who follow the social media must be careful enough to discriminate between a scientific content and unscientific content. Unfortunately, in social media, especially in WhatsApp, what comes mostly is miseducation and misinformation. The scientific content will come from professional organizations. So they must always ask for the authenticity of a post which comes in a media, be it in WhatsApp, be it in Facebook, in Instagram. So it is not something like where you talk about cooking, fashion, etc. Sexual health education is a scientific subject. A scientific subject should come from accredited bodies, not from any Tom, Dick and Harry. Unfortunately, what is happening today, many unqualified people, they have an access to the social media and they propagate myths and misconceptions. Not just in WhatsApp, in YouTube. I have seen unqualified people who call themselves doctors. They propagate misinformation on the YouTube. And many youngsters who believe that they fall. Now the media has got a role, manages the media. They should be discriminative enough to understand who is a competent and qualified authority, who is not a qualified authority. And number two, whatever information they want to post on their sites, they must think we will be benefiting the public or not. Sensationalization is not going to help anybody. Rather than telling people what should be done, what should not be done, that's very important, rather than sensationalizing. Electronic media, when it comes to television, I found in most regional languages, after 10:30, unqualified people pay money to the channel and they take half an hour slots. And they create fear and panic among the viewers, saying that this is bad, this is not good, if this happens you lose your manhood, etc. And our youngsters believe that and run to them. And once this gets into their mindset, it's very difficult to make us help them to overcome the fear and overcome the negative thinking. It's going to be a long-term process. So the responsibility is both on the media managers as well as the people who use the media.
Yeah, absolutely. Very, very nicely put, Dr. Reddy. And I really hope that people listen to these wise saying and insights and adapt better behaviors and strategies in their behavior with themselves, their peers, and in their society. And with this, I would really like to thank you for coming to this conference and for having an interview with us. Really thank you for this.